So take your vitamins this morning, some supplements. Apparently, they may not do anything to help your heart. That's according to new research, which reviewed studies of almost a million patients here. Researchers did find a few advantages like omega-3s or fish oil, reduce the risk of heart disease, folic acid, lower the risk of a stroke, but they found that taking calcium with vitamin D actually made a stroke more likely. And almost everything else, though, did not really, again, have major impact on your heart health. So let's bring in Dr. Darria Long here, emergency room physician. So first off, patient comes to you and says, I'm thinking of taking supplements. You say?
That's a very good question. I get a lot of them, but I say you cannot out-supplement a bad diet. So number one is I tell my patients, if you want to take them, let's check levels. You don't want to just take them blindly because as this study showed, just taking calcium and vitamin D can increase your risk of stroke. We found that taking a vitamin E when you don't know if you're low can increase your risk of prostate cancer in men. So check your levels, supplement if necessary, and then recheck. Don't just blindly take them.
Okay, so if yes, I get it, that if I should eat well and get all my vitamins and nutrients that way. In this busy world, that doesn't always happen. Am I better off getting, hence the word supplements, some supplements in there or not? Go ahead.
And we're all so busy, and that's why we're here, is to try to simplify this and simplify health for people who just have too much on their plates. So what I do say is, number one, just try to eat more greens. I mean, we talk about your fancy diets or trendy diets by name. I don't care. I just want 60% of your diet to be greens. So the number one thing is everybody watching, just try to up by 1 cup a day of greens. You're going to get all sorts of nutrients that a supplement, which is a synthetic nutrient, cannot replicate the hundreds of nutrients you're going to get in that cup of greens. And then remember that, do that, and then check with your levels and take supplements if you need to.
This study really zoned in on heart health. We looked, my producer and I, we looked at a WebMD, somewhat of a suggestion on some supplements that could help heart health: magnesium, folic acid, which was cited, vitamins B6, B12, niacin, potassium, calcium. Do you agree with that assessment there?
So I'm glad you brought that up, because what the study showed is they said folic acid may help. Well, it actually was only shown to help for people in China where they don't have folic acid supplementation. And again, they also saw calcium and vitamin D, if you're not low, can increase your risk of stroke. But if your vitamin D is low, then yes, you want to supplement. So all of these ones that you suggested, including niacin, if you don't need it, you can increase your risk of problems. But if you're low in these things, then supplement. But do it in concert with your doctor to make sure you're only taking it for things that you're low in and not just blindly taking. We pretty much know now, just blindly taking a multivitamin really isn't going to help you.
So, and that's what I was going to ask. If someone's just starting out, they're going to see their doctor in a few months. I want to get a few vitamins and supplements in the meantime. Are there any that you say, then let's go over the basics? A multivitamin, C, fish oil. Yes or no?
So for the most part, I would say no.
No.
Don't save your money. And most of them, just save your money, go talk to your doctor, see what you should be. And in the meantime, try to get more of those in your food. But save your money. Don't go buying this big pharmacopoeia if you don't know you need it. Supplement in a targeted way, not in a blind way.
Nice job. See the doctor if you're deficient. Supplement then.
Yes, and eat that extra cup of greens.
Yes,
just
more greens, Cheyenne.
I know what I'm having for lunch.
Yes, spinach.
Yes,
Thank
lots
you.
of it.